Assalamualaikum and greetings. Today we are going to discuss about the respiratory syncytial virus. Let us start with the overview. According to WHO 2025, respiratory syncytial virus, also known as RSV, cause infection of the lungs and respiratory tract. It's so common that most of the children have been infected with the virus by age 2. It's an RNA virus with two genotypes, A and B, that is a member of Pneumoviridae family. The risk of severe RSV disease and death is highest in infants, particularly those less than 6 months, from minor upper respiratory tract infection, which are the most common, to potentially fatal lower respiratory tract infection. RSV produces a broad range of respiratory illnesses. Viral disease that the virus causes is acute lower respiratory tract infection amongst the children. Thank you very much. Let us continue with the causes and transmission. RSV is spread from one infected individual to another through infection respiratory particles in the air. Additionally, it is believed that the virus can be spread by direct contact with sick individual, although contaminated support. By their second birthday, nearly every infant has contracted RSV. Some can get quite unwell, while mostly only mild ill. Older children are frequently reinfected with RSV but typically only have moderate symptoms. By WHO 2025, RSV can spread when a person who has RSV coughs or sneezes near you. You can get virus droplet from cough or sneeze in your eye, nose, and mouth. You have direct contact with the virus, like kissing the face of a child with RSV. You touch the surface that has the virus on it like a doorknob, or touch your face before washing your hands. Continuing for the symptoms and clinical feature, the first symptoms of RSV usually present between day 4 to 7 after exposure to the virus. Signs and symptoms of upper respiratory illness include runny nose, sore throat, headaches, and fatigue and fever. It is to be noted that although most children may present with fever during RSV infection, a certain proportion of young children may not. Signs and symptoms consistent with lower respiratory tract infection include cough, shortness of breath, fast breathing, bronchospasms, wheezing. Severe lung disease can cause respiratory muscle exhaustion, low oxygen level in the body, occasionally even death. Early life RSV may result in long-term respiratory effect, including as repeated hospitalization for respiratory ailment in infancy. For the risk factor of respiratory syncytial virus are the following individuals are more susceptible to serious or occasionally fatal to RSV infection. Babies, particularly those who are 6 months or younger, or it can be a premature babies. Children with chronic lung disease or congenital heart disease, which can affect their heart from birth. Adults or children whose immune system has been compromised by illnesses like cancer or chemotherapy. Youngsters suffering from neuromuscular condition like muscular dystrophy, adults suffering from lung or heart condition, or it can be senior citizens, particularly those 65 and older. That's all. Last but not least, how we can control and prevent RSV virus. To plan out strategies on how to tackle it. RSV does not have a specific treatment. Supportive therapy for severe RSV sickness, including intravenous fluid for hydration, nasal suction of secretion, and most importantly, supplemental oxygen to aid in breathing. To avoid severe RSV sickness in newborn and older adults, a number of vaccination products are currently on the market. Everyone can do their part to stop RSV virus and other respiratory disease from spreading, such as clean commonly touched objects, wash or sanitize your hand frequently, and mask your cough and sneeze to practice excellent hygiene. Cleaner air can be achieved by gathering outside, filtering indoor air, or bringing in fresh outdoor air. When you're ill, stay at home and avoid people.